Hello, and welcome to another educational infographic from Professor Mohammadi's teaching archives. In this presentation, we will review developmental assessment in children, common pitfalls, and how to avoid them. Accurate developmental assessment is extremely important for early identification of delays, timely intervention, appropriate support, and improved long-term outcomes. However, several common mistakes can lead to misdiagnosis, over-referral, under-recognition, or unnecessary family anxiety. Let us go through these pitfalls one by one. The first pitfall is relying only on age norms. Sometimes clinicians compare a child only with age-matched peers without considering the child's own developmental trajectory. This may miss delays in children who previously functioned at a higher level, or may incorrectly label naturally slower but steadily progressing children. To avoid this mistake, always consider the child's individual developmental history and pattern of progress over time, not just age cutoffs. A key reminder is to look for change over time and use growth and developmental charts appropriately. The second pitfall is using inappropriate or incorrect tools. Assessment tools that are not validated for the child's age, language, culture, or condition may produce inaccurate results and misclassification. The solution is to use developmentally appropriate, culturally fair, and validated instruments. Clinicians should also ensure proper administration and scoring of tests. Always check the norm population and ensure good quality translation or adaptation when using developmental tools. The third pitfall is not considering individual variability. Not all children achieve milestones at exactly the same age. Expecting rigid milestone timing can result in unnecessary anxiety, over-referral, or incorrect labeling. Instead, understand the normal range of development and interpret findings within the child's broader context, including temperament, environment, health, and opportunities for learning. Remember to use milestone ranges rather than fixed ages. The fourth pitfall is ignoring multiple information sources. Relying only on formal testing or only on parental report can result in incomplete or misleading conclusions. Good developmental assessment requires gathering information from multiple sources: parents, teachers, caregivers, direct observation, records, and standardized tools. Clinicians should triangulate information, ask open-ended questions, and observe the child in different settings whenever possible. The fifth pitfall is overlooking medical, sensory, or environmental factors. Conditions such as hearing loss, visual impairment, sleep disorders, malnutrition, trauma, psychosocial stress, or poverty may mimic developmental delay. Therefore, clinicians should screen for medical, sensory, and psychosocial factors that may affect development. A simple hearing or vision check may sometimes completely change the interpretation of developmental concerns. The sixth pitfall is making a diagnosis too early based on a single snapshot. Development is dynamic. One isolated assessment may not fully represent the child's true abilities. Premature labeling may harm both the child and family emotionally and socially. To avoid this, reassess over time, evaluate consistency across situations, and monitor the child's progress longitudinally. Avoid rushing to label. The seventh pitfall is not involving families in the process. Parents and caregivers provide essential insights into the child's everyday functioning, strengths, and challenges. Excluding families may lead to poor follow-up, low engagement, and less effective intervention. Instead, clinicians should partner with families, respect their knowledge and cultural perspectives, and involve them in decision-making. Clear communication, active listening, and family-centered care are critical. Now let us review the key message highlighted in the infographic. No single test replaces good clinical judgment. Always evaluate the child, the developmental context, and the progression over time together. When in doubt, monitor, reassess, and collaborate with the family. Thank you for joining this educational review from Professor Mohammadi's teaching archives.